The first cranial nerve is the olfactory nerve that has to deal with the sense of smell. The second cranial nerve is the optic nerve, which is the nerve for vision.
Look at all that food!
The third cranial nerve is the oculomotor nerve. This nerve controls muscles such as eye movements up, down, and medially, the opening of the eyelid, pupillary constriction, and focusing. The fourth cranial nerve is the trochlear nerve. This nerve controls the muscle that rotates the eyeball immediately when you turn your head side to side.
No, not today.
The trigeminal nerve is the largest nerve of the cranial nerves and the most important sensory nerve of the face. It forks into 3 divisions. The first division is the ophthalmic division. It controls touch, temperature, and pain sensations from the upper face.
Ouch.
The second division is the maxillary division. It controls touch, temperature, and pain sensations in the lower face.
Ouch.
The third division is the mandibular division. It controls touch, temperature, and pain sensations in the lower face as well.
Ouch.
The abducens nerve controls a muscle that turns the eyeball laterally. The next nerve is the facial nerve. This is a major motor nerve of the facial muscles. It divides into 5 prominent branches: the temporal, zygomatic, buccal, mandibular, and cervical. The function is taste, facial expression, secretion of tears, saliva, nasal and oral mucus. The next nerve is the vestibulocochlear nerve. This is the nerve of hearing and equilibrium, but it also has motor fibers that lead to cells of the cochlea that tune the sense of hearing.
What's up? Your parents never even loved you. The ninth cranial nerve is the glossopharyngeal nerve. It's a complex mixed nerve with numerous sensory and motor functions in the head, neck, and thoracic regions, including sensation from the tongue, throat, and outer ear. Some of its functions are taste, touch, pressure, pain, and temperature sensations from the tongue and outer ear, regulation of blood pressure and respiration, and motor functions such as salivation, swallowing, and gagging. The 10th cranial nerve is the vagus nerve. It has the most extensive distribution of any cranial nerve, supplying not only organs in the head and neck, but also most of the viscera of the thoracic and abdominopelvic cavities. It plays major roles in the control of cardiac, pulmonary, digestive, and urinary functions.
Man, I really gotta pee.
The 11th cranial nerve is the accessory nerve. This nerve takes an unusual path. It arises from the upper spinal cord and not at all from the brain. Therefore, strictly speaking, it is not a true cranial nerve. The accessory nerve controls mainly swallowing and neck and shoulder muscles. The function of this nerve is swallowing, head, neck, and shoulder movements. The 12th and final cranial nerve is the hypoglossal nerve. This nerve controls tongue movements. Its function is tongue movements of speech, food manipulation, and swallowing.
Mm-hmm.